Hello dear viewers, in this video, which is part 9 of continuous renal replacement therapy, I will be discussing part 3 of regional citrate anticoagulation, where I will discuss factors which determine the dose of citrate. Specifically, what factors affects the dosing of citrate infusion initially. After initial empirical dose, the flow of citrate is monitored and adjusted based on target filter ionized calcium value. From the perspective of principle of using regional citrate anticoagulation, there are four factors that determine the dose of citrate, and it includes blood flow rate, the site where replacement fluid is added, composition of replacement fluid, and individual anticoagulation intensity target. We will discuss each one of them in some details. The first and foremost factor is blood flow rate. The citrate flow rate must match the blood flow rate to ensure a stable anticoagulant concentration in the extracorporeal circulation and should be adjusted accordingly after a change in blood flow rate. I have already discussed relation between blood flow rate and citrate dose in a greater detail in my previous video. You can check it there. I will share the link in comment section. Other variable which affects the citrate flow rate is site where replacement fluid is added. If a calcium-free replacement fluid is used in pre-dilution mode, the blood entering the filter will be diluted so that ionized calcium concentration in the filter will decrease and the demand for citrate will decrease accordingly. The third important factor is composition of replacement fluid. Whether the replacement fluid contains calcium and magnesium also affects the flow rate of citrate. If calcium containing replacement fluid is used in pre-dilution mode, the amount of ionized calcium entering the filter will increase, requiring more citrate to chelate them. If calcium containing replacement fluid is used in post-dilution mode, the impact on the amount of citrate will be small, but it may increase the risk of coagulation in the post-filter air trap chamber. Fourth factor which is relevant to the citrate dosing is individual anticoagulation intensity target. The anticoagulant intensity required in vitro may vary depending on the coagulation state of the patient. There is a huge individual difference in the ionized calcium threshold to prevent blood coagulation, such as satisfactory anticoagulation is achieved in some patients when ionized calcium in the filter are only less than 0.5 millimole per liter, while in some others they are required to be 0.2 millimole per liter strictly. Remember, anticoagulation intensity should not be set solely based on the level of ionized calcium. Although the target range of 0.2 to 0.4 millimole per liter of ionized calcium in the filter is appropriate for most patients, in practice the target value should be individualized according to the actual treatment process rather than being restricted to this range, especially when clotting starts to occur in the filter. It would call for empirical increase of citrate infusion rate to minimize clotting propensity despite the level of ionized calcium is in the range in post filter. Here I finish. Hope this video is useful to understand the nuances of regional citrate anticoagulation. If you have any questions, please write them down in comment section. See you in my next video on CRRT part 10 and regional citrate anticoagulation part 4. Till then, bye and take care.